restrictive, and also you mentioned one of your residents actually mentioned that she can use it for lupus condition. So
Yes.
would you consider further expanding it?
Indeed, I think, and the track record shows that we have been, over the last 5 years, progressively extend the use of MediSave. But we do it, every step is calculated because the fear is always abuses. Yeah. It's easy to just simply open up the floodgate. What you do not want is MediSave suddenly become depleted, and then when you are really sick and hospitalized, you find that you run out of money. I think that would be very sad. So you need to progressively calculate each move and implement them as proven. And there lies the complexity of healthcare. The healthcare is not a simple ministry or simple sector where well-intentioned ideas will create desirable outcome. In fact, the experience all over the world is that in healthcare, many, in fact, most well-intentioned ideas end up disastrously. That it does not achieve what the planners thought it will achieve. I think the most extreme case is the British National Health Service. And I've read the first paper that recommended the introduction of NHS. This was soon after the war, 1948. Wonderful report. And it started out very well-intentioned. People are poor because this was soon after the war. Many people are out of jobs. Many are handicapped. So the proposal was a very gentle and kind one. Let us make healthcare free, fully paid for by taxation. That way, people who are sick will get good care. And once they get good care, they become healthier. And once they become healthier, the demand for healthcare will drop. Because the corollary is, because you are sick and because you are poor, you cannot get good medical care, you become sicker. And when you become sicker, more complications, your demand grows. So that was the theory. It sounded very good. But what is the outcome? In fact, the outcome was seen immediately, within a year. Demand never came down. Demand just exploded. Because now it's free. And between 1948 and now, you know how much demand has exploded in UK. So every generation of British politicians know deep inside that that is not sustainable. But nobody have the political guts to say, let's bring in reforms and fix some of the problems. And that was the problem of free healthcare. We have avoided those big pitfalls, and that is how we ended up high standard of healthcare at only 4% of our GDP. Yeah. If we move away from there by adopting some of these ideas which are being put forward, I think you will walk back into those pitfalls.
Yeah. One of the main issues of this is GE are foreign workers. And I think you also touch on that, medical foreign workers, and you say that it's necessary if you want to have more beds, more, etc. Could you expand on that a little bit?
Yeah. Because I know there have been periodic feedback that patients, especially those who cannot speak English, who can only speak dialects, so they find that either doctors or nurses cannot speak their dialect. So communication is a problem. And when you are sick, you hope that a doctor and nurses fully understand what are your problems. So I appreciate those concerns. We try very hard to address them by assigning doctors or nurses with dialect skills. But there are limits to it, because it's not just foreign doctors and nurses cannot speak dialect. Many of our new generation doctors and nurses also cannot speak dialects. Yeah. So, but I pointed that one out just to make a point about that life is not ideal. There are trade-offs you have to make. You want more of this and more of that. And at the same time, you also don't want some of the problems of having foreign workforce. We have to make a judgment call. If you insist that all doctors and nurses must be dialect speaking, I think we will lose probably more than half of our current medical and nursing staff. So that's not practical.
So you continue recruiting doctors and nurses from overseas?
I think we have no choice, even as we continue to increase the training. But I also make a point that nursing is a tough profession. We are very grateful that we have always have very dedicated Singaporeans who choose this profession, but never enough, because the way forward, especially with aging of population, we need many more nurses. And if we do not have enough Singaporeans coming forward to join this profession, then I think we have no choice but to top up. So it's a question of how do you manage the proportion. We used to have even higher proportion of foreign nurses, more than 25%. But over the last 3-4 years, we have managed to cut it down to about 20%, even though the numbers have grown in absolute terms, but the proportion has come down. Thankfully, it's because many more young boys and girls are now enthusiastic about joining the nursing school. And that's why we very rapidly expanded nursing capacity. So now there are 2 polytechnics teaching nurses, and there are also undergraduate program for that. But we will never have enough, unfortunately. Yes?
Yesterday, Senior Minister Khaw as well as PMD said how the next few days, the remaining days of campaigning, the PAP strategy is then to turn, sort of put the opposition on the defensive. From your point of view, what is your plan? What are you going to do?
I never think it wise to discuss strategy through the media. But my own campaign approach is to always focus on what I can do and explain as clearly as I can what I plan to do and let the voters judge. And I hope that the voters will similarly ask of other opponents what they plan to do, what can they do for them, and then let them make that decision on which candidates, which party can you trust, which candidates, which party's ideas can benefit you. That, I think, is the right way forward.
In 2006 GE, healthcare was a huge issue. Right? But this
Was it?
It doesn't appear to be very much on people's minds. What do you think? Why do you think that's so?
I like to believe that because we have managed it reasonably well, so that health, I think, is not as hot an issue as other areas. And I think, but at the same time, I know there's always an undercurrent of concerns about healthcare, the worry about healthcare costs. Because if you ask anybody, are you worried about healthcare costs? Even if you ask me, I would say, yes, I'm worried. I'm worried because you can see the whole world, the trends of healthcare costs. It continues to rise. And really there's no magic solutions to bringing down healthcare cost. And the answer is a very simple one, because we all know the bulk of healthcare services is manpower cost. You need good doctors, good nurses to deliver good healthcare. I mean, there's no shortcut to that. So good doctors, good nurses are also high salary. These are skilled workers. So how can you suppress doctors' salary, nurses' salary in order to keep healthcare costs low? So what instead needs to be done is recognize that as a constraint, and then making sure that very expensive skilled resources are put to proper use. We certainly must not abuse them. And that's the reason why there is always some crowding in public hospitals. We have no we have no choice, because if you do not want crowding, what does it mean? It means that you keep doctors and nurses, you put many more doctors and nurses than necessary, so that they are effectively in the clinic waiting for patients to appear. Then there's no waiting, because it is service on demand. When you go there will always be a doctor waiting for you. That is the case in private hospitals, in many private hospital clinics. But the cost then is very high, because they are not providing charity. So it translated into high fees. So what we try to do is try to run an optimal level. I mean, a good example is hospital beds. So we run 85% occupancy rate, which I don't think is too high, because if you run it too low, then your cost is very high. Your overheads become very high. So these are some of the realities about healthcare, which I hope Singaporeans can appreciate. These are some of our problems. And these are some of the trade-offs that, in fact, we have to make. It's easy, to run a system that has no waiting, but then the cost will be very high. Yeah. So the other extremes is, you run a service that is overcrowded, over too long waiting, that surgeries waited for months. That is also no good. Yeah. So I think, I won't say, we have a perfect sweet spot, but I think it is a reasonably satisfactory outcome that we have created. Yeah. We can certainly improve further. Yeah. Yeah.
Minister, you mentioned about an elder shield nurse, which is well. Could you give us more details on how you've done the upgrades?
I have discussed this off and on, because I did one upgrading of Elder Shield once. So the claims have been raised from $300 per month if a person is severely disabled to $400 per month. But even when I did it that time, I made the point that I know 400 is still not enough. Yeah. And I always felt that somewhere around $800 per month would be more appropriate. But because we have just done Elder Shield reform 2-3 years back, so I said that at the next round of reform, I certainly would want to try to see how we can upgrade it. So that is something that we will do during the next term of government. Yeah.
As for the upgrades to MediShield, is it just an expansion of the number of diseases that we can expect? Or?
I think there's one aspect, because some illnesses are not yet covered. Mental illness is one, congenital is another. So those are the type of illnesses that I think we ought to try to bring them in. Yeah. But there will always be, because with medical inflation, the payout from MediShield, after a while, after several years, will then become not adequate. So periodically, every few years, you do need to make adjustments. So I think I would gather all those necessary changes and do another round of reform package. And this is likely to happen during the next term of government. Yeah.
Premiums will go up.
Yes.
So you again get complaints from people because then the interest premium will go up.
Yeah.
And then the question is, should the government actually look after these people with congenital disease, or should we pass it over to the group of people who are insured and have them look after these people?
So those are parameters that you have to manage, because it's not a one parameter thing. So it's a collection of things. Subsidy level, we will see whether there's need for adjustments, or Medifund. So these are trade-offs that I spoke about earlier. There are many ways to formulate an optimal solutions. Yeah. I felt that we have a not bad healthcare system. Not bad in the sense that it delivers a very high standard of care and at a cost which is not too excessive for the entire community. Because every time when we talk about, say, cheaper healthcare in other countries, one must never forget that there is only one facet of the cost equation. Because cheaper healthcare does not mean healthcare comes from out of the sky. It is funded by taxes or by employers. So you have to look at the total system. And the total financing is therefore measured in terms of how many percent of your GDP is spent on healthcare. So when we say we only spend 4%, means collectively 4% of our salaries go to finance healthcare, versus 17% of Americans' income go to paying for healthcare, or 10% in UK going to healthcare. So we know that 4% is unlikely to stay permanent, so in due course it may creep up. But if we manage it properly, we hope that the 4% maybe become 5%, then 6%, and always remain significantly lower than what the other countries are doing. Because this translates into advantages of competitiveness. Why are American employers yowling out? Because the 17% is actually largely borne by them. It's a well-known fact that every General Motors car produced by them, several $1,000s per car, goes to finance the pensions of GM workers. This is a well-known fact. Versus, say, Toyota in Japan, it is much less. So straight away, between GM and Toyota, your competitiveness is affected by high healthcare cost. And that's why when somebody said, let us, increase our number of hospitals so that we are like Americans, I hope he or she understood what he's talking about. It means, do you want to make your companies in Singapore less competitive than they are today? So again, those are further illustrations of the trade-offs one needs to make when we talk about a subject which impact different sectors of the economy like healthcare. Anything else? Okay, yeah, what is it?
This morning during the walkabout, you brought up the issue of nursing care. They were saying that many of the families are actually experiencing a heavy burden in financing costs of sending their parents to nursing care. And I know the Ministry of Health have expanded, the number of nursing homes and all that, but I guess the cost is still a concern. So would that be more done to help, especially the middle-income families, cope with these costs?
I think part of the solutions, the more effective solutions, is the Elder Shield reform that we talk about. Yeah. Because if you can pool the risk and spread the risk better through insurance, I think it can help ease many of these burden. It's a little bit like kidney dialysis, because over the years, because we promoted MediShield properly widely to the Singaporeans. So I myself am very happy that each time when I visit, say, NKF dialysis centers, I would always ask the patients, are you covered by MediShield? And my own little, straw poll there has always been easily 80% of them are covered by MediShield. And they will go on to say that if not for MediShield, life will be tough, because their cost is about $2,000 per month. MediShield take out about $1,000. So that half their burden. Yeah. So nursing home is the same thing. If you want to have a good nursing home, I think the cost will also be around $2,000 a month. But if your Elder Shield payout can be, as I propose, about $800 or even better, $1,000. And since you mentioned about middle income means you probably should be able to top up your basic Elder Shield with a private ElderShield, which can pay out higher. So if you subscribe to a higher shield that pays out, let's say, 1,500, then effectively you reduce your outlay burden. I think that is the correct way to resolve this or to address this rising healthcare cost problem. Yeah.
A lot of these people are over the age of 85, where your Medishield does not cover them. I believe they've got 10,000 people over 90 years old in Singapore, according to the census. So these are the people who are, the bulk of them are in nursing homes.
I don't think we should say that. I don't think that's correct, factually. I won't say the bulk of our 80s are all in nursing home. I don't think so. I don't think so. The incidence rate is not so high. Yeah. So I think one should not, draw wrong conclusions. Yeah. But progressively raising coverage age is something that we have been doing. So it is not frozen. But meanwhile, those who are more concerned, there are private shields which offer a higher coverage age. But basic ElderShield, we will definitely, adjust the age ceiling as necessary. At least during my term, the last 5 years, I think I made one major adjustment once, from 75 to 80. So, sorry, or whatever. Yeah, I can't remember. Yeah, yeah. I think if life expectancy continue to rise, there is justification to raise. Yeah.
Over the next 5 years?
I don't know, because I cannot predict over the next 5 years how our life expectancy will adjust. Yes. Yes. Yeah.
You cannot formulate a health strategy based on a collection of populist wishes. Is that how you describe some of the healthcare proposals put forward by the various opposition parties that they use populist wishes?
Some sounds like that.
Are there any merits to any of the proposals that you make?
I think we let the voters decide. As I said, I'm not in a mood to talk about other people's proposals, but I just my own campaign style is I just tell you what I can do and explain as clearly as I can. Mine is a substantive, detailed program, carefully crafted over the years, and I'm offering that to Singaporeans. And then I think we leave it to Singaporeans to decide, who have a better case as far as health is concerned. Yeah? All right? Okay, thank you. 什么东西？哇！你替我翻好吗？我很累了，我已经整天做了整天了。你替我翻了啊。